Hello and welcome to this Africa media briefing with the World Health Organization. I'm Adrian Monk at the World Economic Forum here in Geneva.
Et mon nom est Peter Van Am pour ceux qui nous rejoignent depuis l'Afrique francophone.
Thank you. And welcoming our guests, Dr. Matshidiso Moeti from Brazzaville, Congo, Regional Director of the World Health Organization in Africa, her colleague, Dr. Michelle Yao, Dr. Chikwe Ihekwazu from the NCDC in Abuja, Nigeria, and Dr. Sani Aliyu, the National Coordinator in Abuja, Nigeria. We'll be turning first to Dr. Moeti in Brazzaville for a few words of introduction. Dr. Moeti, over to you. And we just need you to unmute.
Joined us.
Thank you. We can hear you now.
Okay, good afternoon, and thank you to everyone for having joined us today. I'm very pleased, really, to be joined by colleagues from the Presidential Task Force for COVID-19 and the Centers for Disease Control in Nigeria. In Nigeria, we're seeing strong leadership, private sector partnerships, and scaling up the key public health measures. And I'm sure that Drs. Aliyu and Ihekwazu will share more on their progress, priorities, and challenges today. On the African continent, there are now more than 25,000 confirmed COVID-19 cases, and more than 1,200 people, unfortunately, have lost their lives. South Africa remains the most affected country with 3,300 cases, but they are starting to see a bending of their curve due to some of the measures that they put in place. There are concerning increases in some countries in West Africa and also in Tanzania. Active case finding and tracing and isolating all contacts, along with physical distancing and hygiene measures, remain the key interventions to stop this virus. We are concerned that in some settings, of course, physical distancing measures are preventing people from accessing life-saving health services. Even in times of lockdown, these essential services must be continued. Tomorrow is the start of the African Vaccination Week, and on Saturday, we commemorate World Malaria Day. These are two reminders of the importance of essential health services. In 2018, there were 213 million malaria cases and 360,000 related deaths in the African region, accounting for over 90% of the global burden. With partners, we are studying the potential impacts of COVID-19 on the malaria situation. A recent analysis has found that if insecticide-treated bed net distribution stops and case management reduces, malaria deaths in sub-Saharan Africa could double in comparison to 2018. This would be the highest number of deaths seen in the region since the year 2000. So I urge and encourage all countries to maintain malaria interventions in line with WHO recommendations to ensure that health workers and communities are protected. We saw with the Ebola virus disease outbreak in West Africa that we actually lost more people to diseases that we previously were managing to control, like malaria, than we lost to the outbreak itself. Let us not repeat that again with COVID-19. Despite progress in immunization, still 1 in 4 African children are under-immunized. To protect communities from diseases like measles, polio, and yellow fever, it's imperative that routine immunization continues. Immunization campaigns may need to be postponed because of challenges with physical distancing, and countries will need to rapidly and safely scale up these activities once the COVID-19 transmission is contained. So whether we're fighting COVID-19, malaria, or vaccine-preventable diseases, community empowerment is essential, and we are working with our colleagues in UNICEF, with the Red Cross, and other civil society groups to ensure that individuals have the information and the resources to protect themselves and their families. And I'll close, since Ramadan is starting, and I would like to wish all Muslims Ramadan Kareem. Thank you very much.
Dr. Moeti, thank you. Moving on to the National Coordinator of Nigeria's Presidential Task Force, Dr. Aliyu in Abuja. Just some opening remarks from yourself, Dr. Aliyu. We're hoping we can get you to unmute. Can we unmute Dr. Aliyu, please? Okay, I'm just seeing a red muted sign in your box, and we just need that to turn off so that we can hear from you. So just asking the gallery here in Geneva if we can see you speaking. We can't hear you speaking, unfortunately. So it'd be wonderful if the gallery could just tell me if we can go to Dr. Aliyu or if we will need to turn to Dr. Ihekwazu in the meantime.
Thank you for that. Hello, can you hear me?
We can hear you now. Thank you.
So the host muted me, so it wasn't a problem from this side. Thank you for inviting me to this session. I think it's incredibly important we continue to work together to get on top of the pandemic, particularly in Nigeria because of the our population and the nature of the country's terrain. My opening remarks really will concentrate mostly on the multi-sectoral part of the response, even though we know that COVID-19 is a major health concern, but really the impact goes way beyond just the health sector. So in order to make success really of this response, we do need a diverse mix of stakeholders, and that's what we've done over here in Nigeria. We've got a presidential task force with about 9 ministers and heads of various MDAs, including the Nigeria Center for Disease Control and the Primary Healthcare Agency, as well as a representative of the World Health Organization. And at a lower level, we are also linking up quite closely with the private sector, development partners, civil society, as well as community and religious leaders. It has been quite a difficult role when it comes to national coordination of such a large country. And I'm very much aware of the fact that if we fail to bring everyone on board to work towards a common goal, then definitely the consequences will be quite severe. So what have we done so far in Nigeria? We've really concentrated on trying to understand the pandemic and also support the Nigeria Center for Disease Control. They have the incident management system with the response center that's quite effective, and that also pulls along the various subnational structures. We've set up a national pandemic response center which will serve as the operation and coordination hub of the presidential task force. We've designed a national pandemic response plan, which really has been a mix of both the Center for Disease Control Incident Action Plan, as well as a previous national pandemic influenza response preparedness plan that we've now modified and brought to turn it into a single document. Been working quite closely with the UN to set up a single basket system for funds. We also have several contributors along, including the private sector that have set up quite an efficient coalition against coronavirus, and they've been involved in trying to improve the health infrastructure and also create more isolation beds across the country, as well as supporting us in terms of all the procurement and the logistics required of such a large country. We have been trying to harmonize all our needs across the board. I had a meeting just today with parts of the donor community, and we are really adopting an all of society approach. One of the challenges we have has to do with the nature of the state and the federal structure in Nigeria, where the state governments are relatively independent, and health, particularly the primary and secondary health sectors, are primarily driven by the state governments. But we've been engaging them really closely as very important key stakeholders. We also have had challenges in terms of fragmentation when it comes to cessation of movement. At the federal level, we've closed Abuja and 2 of the states in the southwest, Lagos and Ogun. But for the rest of the country, state governors have taken it upon themselves to have their own initiative in terms of cessation of movement and also implementation of other preventive measures. Moving forward, this is something that we hope to correct at some point. And then finally, you said there were a lot of questions about how we're with the socioeconomic aspects of a closure in a society that has such a large number of people requiring daily to go out daily for their uptake in terms of getting money, etc. So we've worked with the Federal Ministry of Humanitarian Affairs. We've released 70,000 megatons of grains from the National Reserve. We've also provided about 100 trucks of rice to be distributed across the country, relief materials, including in the IDP camps, as well as conditional cash transfers. So it's a large country, and I'm afraid it's probably going to be a drop in the ocean compared to what is needed from a socioeconomic impact side of in the society.
Right.
So I think I'm there for now, and hand over. Happy to
Thank you so much, Dr. Aliyu, and for that briefing. I know there's a lot of questions that journalists have for you on that. Dr. Ihekwazu at the Nigerian Center for Disease Control, can we just turn to you for a brief introduction on what you and the NCDC are doing?
Yeah, so thank you very much, and it's a real pleasure to be with you on this call. I think my colleague, Dr. Aliyu, has given a broad sector-wide update on what we're doing. In terms of the health sector itself, I mean, the first thing we had to do was rapidly scale up, rapidly develop testing capacity in Nigeria. And starting from zero, that is probably the first challenge we all face across the continent. And that's the biggest change that has happened since the Ebola outbreak and now is the coordination ability of the World Health Organization and the Africa CDC, who really came together in those early days to rapidly support us in developing testing capacity across the country. Obviously, that has developed at different paces in different countries, depending on their underlying infrastructure for laboratory diagnosis, which inevitably has an impact on the number of cases. So we now have 873 confirmed cases and affecting 26 states in Nigeria already. So you can see how diverse. It's a big country, 200 million people, one of the highest population densities in the world, some big cities, and the outbreak right now is driven by transmission in 3 big cities, Abuja, Lagos, and Kano. And the dynamics of controlling an outbreak in the cities, the mega cities that we have in Nigeria really requires a certain extra set of skills, capacities. I've just come back from a tour of 9 states in Nigeria in 3 days, and it was incredibly, on one hand, reassuring seeing the efforts made by state governors across all the spectrums of the disease, from surveillance to lab diagnostics, risk communication, but also seeing the challenges they face. You know, in a city like Kano, it takes an extortionate amount of effort to build up the infrastructure for a response and to then deliver that across the state. So Lagos had, obviously, our first cases were in Lagos and Ogun. So they had the opportunity of learning quicker, and therefore they have developed a bit more. So now what we're trying to do is transfer some of the knowledge that we've gained in one state to another state to ramp up those capacities. So in a way, we're running against time. Our curve is going up. We're under pressure from the population, like Sani said, in terms of enabling the population return to some semblance of normal life, because people have to live every day and earn a living. But at the same time, we're confronted with this curve that is still on the escalation phase. So how to balance this will be very difficult decisions we will have to make in the next week. We're in the 4th week of a lockdown period across certain states, but almost every state in Nigeria has implemented some form of a lockdown already. So really, we are, in a way, we have to work with what we have. We wished we had a lot more laboratories functional. We wished we had all the care facilities, the ventilators that we need, but we simply don't. So, and the supply chain for many of these things are fragmented at the moment. So we're doing our very best to make the best out of what we have, make sure we get the best out of that, inform our population of what is happening. Every single day, we release an update on the number of tests, the number of new cases, their distribution, We have a website where we have implemented new guidelines. Today, we're releasing guidelines on COVID and pregnancy. So all sorts of complex issues that we've had to learn very quickly ourselves in collaboration with partners around the world and implement and translate it for our local context. This is a long haul for Nigeria. We're very aware of this, that it's going to be a marathon, and we are preparing ourselves for that long haul as we fight this new pandemic in our own unique, complex context, but beautiful country, Nigeria. So that's really what we're doing with the teams at the federal level and state levels across this country. But really, I think I just want to conclude that the collaboration across the continent has been incredible. You know, I have regular teleconferences with my colleagues in different leading centers like mine across the continent, coordinated by WHO Afro, as well as the Africa CDC. A lot of the test reagents are centrally procured and distributed, at least at the beginning, and now we're scaling up our own procurement processes. But we have relied heavily on a regional collaboration because we are all learning about this together. So I'll end on that note. Happy to welcome any questions that might come on any aspect of the response.
Thanks, doctors. And there are a lot of questions indeed coming in. I'm going to turn first to two journalists. First, Anu Adui from the Mail and Guardian in South Africa, and then next to Ruth McLean with the New York Times in Senegal. Anu, can we just get you with your question first, and then can we get the question from Ruth, please?
Okay. Thank you everyone. My name is Anu Adioye from the Mail and Guardian in South Africa. My question is directed to Dr. Ihekweazu in Nigeria. So South Africa has tested about 130,000 samples and Ghana has about 70,000 tests. But Nigeria is still under 10,000 by your last update. So I want to know, what are the challenges Nigeria is facing to ramp up testing, and what are the steps being taken to ensure that testing gets to the level that is adequate for the population, which is about 200 million?
Thank you, Anu. And also, can we go to Ruth as well? Ruth, for your question. And we need Ruth to be off mute in order to hear from her.
Sorry about that. I thought I had unmuted, sorry. My question, I have a couple of questions. One is to Doctors Ihekweazu and Dr. Aliyu. It's about the situation in Kano, where I believe there have been reports of an unusually high number of deaths. And, you know, there are conflicting reports on this. The governor apparently says that this is untrue. And then there have been also conflicting reports of testing being suspended. Could you tell us what's happening there? And then just a more general question to the panel. I wondered, is there a danger that people suffering from COVID in Nigeria and in many other countries on the continent will not present to health facilities and instead will stay at home? And are there any places in particular where you suspect this is happening already?
Thank you to Ruth and Anu. And perhaps we can turn first to Dr. Aliyu for some light on those questions.
Yeah, we can hear you.
We hear you, Dr. Aliyu.
Okay, thank you. So I think I'll leave the testing issue to Chikwe to answer. But with regards to the situation in Kano, at the federal level, we're monitoring this quite closely. Chikwe and our WHO rep were in Kano a few days ago. The problem is, as you know, Kano is under lockdown. So obviously, we don't have a true baseline when it comes to the number of deaths. It's something that we really need to investigate quite closely, because there are several scenarios here that could be happening. One being that there is a true increase in the number of deaths. The other possibility, of course, could be that it may not necessarily be COVID. It may be an entirely different infection, or, as we all know, usually with lockdowns and restrictions, people find it more difficult to take family members to hospital. A lot of our hospitals in Kano have closed their outpatient clinics. So people with chronic medical illnesses may have difficulty accessing their medications. And even when it comes to having money, simply having money to take care of health needs, since a lot of people will have to go out on a daily basis to get food. So at the moment, there is a small team set up by the Kano state government that's going around and taking data and also doing sort of verbal autopsies, well, so to speak, finding out what the history is, etc. And with regards to what is really happening, I think we just have to watch this space and await the results of the investigations currently being undertaken by the teams in Kano. From the point of view of the laboratory side, yes, the laboratory in Kano was actually closed partly because of an incident where 1 or 2 lab members acquired COVID. It wasn't very clear whether they acquired it in the lab or it was as a result of somebody bringing it in. But that raised concerns about the state of infection control. And we've taken measures together with the NCDC to disinfect the place and also ensure that there's adequate infection control training and regulatory measures with regards to containment are enforced before the lab reopens. But nevertheless, this shouldn't really affect the rate at which we are testing. We've just transported laboratory, sample taking. We've sent commodities yesterday to Kano that would help with further sampling. And we have a fairly good transport network in terms of logistics that would allow samples to come over to Abuja, because the Kano lab also serves Kaduna and Katsina. So we really have 3 states here. We'll continue to work on this. I don't expect the Kano laboratory to be closed for too long. The initial plan was that it would be closed for 3 to 4 days to allow the necessary steps to be taken to ensure that people are working safely. Over to Chikwe.
Thank you. Dr. Hikwasu, can we turn to you on testing?
Yeah, so I know there's been a lot of chatter around this. The truth is, we have to work with what we have. And we definitely didn't start at the baseline which South Africa started at. I spent 3 incredible years at the National Institute for Communicable Diseases in Johannesburg. I'm well aware of the facilities they've built up over the past 30 years in the National Health Laboratory Service. And it's something we will now aspire to building in Nigeria. Many lessons will be learned here in many countries around the world. But, in the middle of a crisis is not the time you can then suddenly build up an infrastructural base that you need 20 to 30 years to build. So we had to rapidly scale with what we have, and we have done so. So up to last week, we had tested 5,000. In the last week, we've tested 5,000. So we've almost radically increased our number of testing, and we will continue to. We have an elaborate laboratory strategy at the moment, converting infrastructure that is built for TB and HIV for COVID-19 testing. The only challenge now is enabling the supply chain to bring in the reagents and primers that we need, which is challenged by the global challenge with the supply chain altogether. So once we have this in, the reagents for Abbott and the Roche equipment, as well as Cepheid converting gene experts for TB, we'll be able to then quickly scale testing across the country. Yes, we've been slow to start, but those that understand molecular diagnosis know that it's not a simple thing to do. People think about testing as a dipstick that you get in and it's either blue or red, giving you a result. It's a very complex, often manual process of dilution extraction, which takes about 6 to 7 hours on a good day. And like Sani has just explained, we activated a new lab in Kano, and very quickly after they had certain problems, we're working with them to solve this. And so it's complex. So I'd rather go a little bit slower and get it right than speed into a situation that we will end up regretting. So some managed acceleration is exactly what we're doing with a deliberate strategy on how to scale. Ghana has a different approach to testing. I know exactly what they're doing. I respect what they're doing, but we don't want to go down that path because it has its own limitations. So I want to assure everyone, we have learned a lot of lessons from this. One of the biggest ones is that You've got to build up your laboratory capacity, your laboratory supply chain. For many of the diseases that are common in our context, whether it's yellow fever or monkeypox, whether it's Lassa, there are no commercially available primers to test for any of these diseases. So it's not just a lesson for Nigeria. It's a lesson for everyone that uses the term global health security. Because if we're really interested in global health security, we have to develop global supply chains for these primers and not leave every country on its own, scratching around for where to find reagents, where to find extraction kits, where to find virus transport media, which is exactly the position we are in, and almost every other country on the continent. And we are all affected because one, if you're affected here, you're a risk to someone everywhere else. So yes, we started from a low base, a difficult situation, but we're deliberately building up our testing capacity. And I'm sure we'll be in a better place. You can see the numbers rising in Nigeria. One explanation for that is a deliberate and strategic improvement in our testing capacity in Nigeria.
Thank you, Dr. Hikwazu. I want to bring in two more journalists, if I may, and then perhaps we can turn to one of our Francophone journalists who we have on video. Firstly, to Libby George at Reuters in Lagos, and then if we can go to Rhoda Odiyambo in Nairobi with the BBC. Libby.
Hi, thank you. Mike, I have two questions, please. First question is, what impact the US decision to defund the World Health Organization will have on Africa, in particular, its efforts to combat COVID? And we'd also like to know, how many ventilators and how much PPE Nigeria has, and what it's doing to make sure it has enough to handle rising cases.
Okay, thank you. And over to Nairobi, to Rhoda at the BBC.
To Dr. Moeti, from the data that you've just given us, how many health workers have tested positive for the novel coronavirus? And my second question is, some scientists seem to suggest that there are about 8 strains of the COVID-19 that are circulating around the world. So has the WHO been able to identify which strain is circulating in Africa?
Thank you. And perhaps we can start with Dr. Moeti on that big question about the potential for different strains of COVID-19 in circulation.
Yes, thank you very much for that question. We are aware that there are different strains of the COVID-19 virus circulating around the world. But we don't have in WHO the specific information about which are circulating where in the African region. I think what we are doing is applying the measures that would apply anywhere with any of these strains, while we work with partners then to look for what particular strains are in Africa in terms of what are some of.
We're just losing your audio, Dr. Moeti. Can we get that back, or are we going to have to turn? Yep. I think we're just going to have to try and get the audio from Brazzaville working again. Perhaps we can just turn briefly to our two doctors in Abuja for some follow-up on Libby George's questions about PPE and ventilators, and also perhaps about that decision from the US. Dr. Aliyu, perhaps first.
Thank you. So first of all, can I just apologize to Rufa? I think she did have a question earlier on about whether there was a danger of COVID-19 patients staying at home. So yes, obviously our health-seeking behavior in Africa and in particular in Nigeria is quite different. Generally, people tend to stay at home much longer until an illness becomes more severe. And then coupled with that, with all the restrictions that are now in place and the limitation in terms of financial resources, I think that's that's a situation that could certainly happen. But we're working quite closely with the media community in terms of making sure that we have provided educational materials and information in terms of TV, radio jingles, etc., so that people are aware of the symptoms and the need. this is already having some impact in terms of the demand for testing. As Chikwe said, we've now pushed up the numbers of our capacity, but we are not seeing a similar uptake in terms of tests from the communities. And our worry is that this might actually be linked to stigma and the fear of having a positive result. In terms of ventilators and PPE, Nigeria, prior to the pandemic, had only about 350 ventilators in the country, 30 of which were in Lagos. Most of the functional ones are actually in the private sector rather than in the public sector. Since then, we've worked hard with partners. I know we've had at least 100 ventilators brought into the country in the last few weeks. We're also putting up structures that would enable at least 10 ICU beds per state across the 37 states of the Federation. But ventilators alone do not run an ICU. Our major, I think, limitation is going to be training of healthcare workers, particularly availability of anesthetists, ICU nurses, etc. And as we all know, it's impossible to train healthcare workers in this specialized field within a very short period of time. And really, that's my concern rather than the issue of ventilators for ICU beds are available. You do need something.
Thank you, Dr. Aliyu. And we can go back to Brazzaville. I think we've just got all the sound back from Dr. Moeti. So if we can just return to her, perhaps on the strains issue.
Yes, thank you. We are aware, of course, that there are different strains of the virus that exist. We are working with some of the partners to do gene sequencing in order to know what are these strains. I think this is what I can say. However, what we're doing is supporting our countries to respond, whatever is the strain, in terms of the major, the most important interventions around identifying the patients, contact tracing, providing treatment, and isolation and preventing transmission of the virus. This is what I can say about that matter.
Thank you. Just briefly to turn to Peter.
Oui, peut-être qu'on peut entendre une question de Roger Mogo, qui est chez Canal+, et qui veut poser une question. Roger, est-ce qu'on peut entendre votre question?
Oui, hello, bonjour à tous. Je suis Dr Roger Mogo, je suis journaliste pour Canal+ Afrique dans l'émission Bonjour Santé à Paris. Ma question s'adresse au personnel de WHO et c'était pour savoir quelles leçons les pays africains pourraient, à ce stade de l'épidémiologie et vu le contexte des autres épidémies qu'il y a en Afrique, et quelles leçons ils pourraient tirer donc de cette leçon d'épidémie de Covid-19 pour améliorer globalement le système de santé en Afrique et surtout afin de prévenir les éventuelles futures épidémies qui pourraient arriver par la suite.
Merci beaucoup, Dr Moyou, et on va peut-être passer à Dr Yao à Brazzaville pour répondre à cette question. On va juste... oui, voilà, allez-y.
Merci beaucoup. Je pense que la leçon principale qu'on peut apprendre, c'est vraiment être préparé, se préparer à répondre, à détecter et à répondre rapidement à toute épidémie ou tout autre événement de santé publique qui pourrait entraîner des décès. L'une des leçons aussi, c'est que potentialiser sur ce qui existe déjà au niveau du système de santé, notamment en Afrique, ce qu'on appelle l'approche intégrée de surveillance de la maladie et de la réponse. Et donc, ces approches-là impliquent les communautés qu'il faut sensibiliser et afin que ces communautés soient alertes et puissent suivre les événements de santé publique. L'autre point qu'on observe maintenant dans au niveau de toute l'Afrique, c'est la capacité de la prise en charge. Et donc, cette capacité doit être anticipée, s'assurer qu'à tous les niveaux du système de santé, qu'on ait la capacité d'isoler au moins des patients qui ont des maladies transmissibles. Et l'autre point, c'est aussi l'aspect de prévention et contrôle des infections qui reste assez faible, ce qui entraîne notamment la contamination de professionnels de la santé qu'on observe déjà dans plusieurs pays. Donc, c'est toutes ces leçons-là, c'est comment intégrer la prise en charge des épidémies au niveau du système de santé dans toutes ces composantes. Merci.
Merci, Dr. Yao. Et on peut passer maintenant à une autre question en anglais, je crois.
We have with us, I think, Paul Adepoyu in Nigeria. If we can get Paul's question. Paul?
Yeah, thank you very much. Paul Adepoju, freelance journalist with the Lancet Medical Journal. So I have two questions. My first question has to do with what are the peculiar tool sets that Nigeria is presently using to combat the current epidemic, and also in the context of Africa too, if the WHO Africa Regional Director can also help us mention some of the local tool sets that are being deployed for the COVID-19 response. While my other question is for Dr. Sonny and Dr. Chikwe. It has to do with the increase in cases of possible stigmatization in which individuals that are having respiratory symptoms could actually struggle to have access to emergency health services in Nigeria. We had the case of a woman that died in Lagos due to the reluctance of health workers to address that. So what is being done to ensure that individuals that may have respiratory disorders or emergency cases are not actually dying because health workers that are afraid of their own personal safety are reluctant to take care of them? Thank you.
Thanks. And perhaps we can start with Dr. Aliyu in answering that last part of the question.
Thank you. So I think that links in very nicely to the question by the previous speaker about PPE availability in Nigeria and capacity. The key reason why healthcare workers are concerned might run away from somebody with a respiratory tract infection is because of the risk of acquiring COVID. So we are working very closely both with the private sector as well as with our donor community to make sure that every facility that's being used as an isolation and treatment center has the necessary PEP equipment required to protect healthcare staff. We also have a very robust communication unit that's linking up through the communities to allow the people to know exactly what sort of symptoms to look for. But more importantly, government is working with medical professionals, the Nigerian Medical Association, and through the nursing side, as well as the pharmacies, etc., to make sure that they have motivation, such as increasing their hazard allowance, something that was agreed on yesterday, and also providing additional life insurance cover. But overall, I think we just have to work together to make sure that people that have chronic illnesses and even acute illnesses and require emergencies, our emergencies continue to be open and are able to operate effectively to save lives. Over to you.
Thank you. And Paul, could you just re-put your question to Dr. Moeti, because we've got a slightly difficult line into Brazzaville today. So if you could just re-put your question, that would be fantastic.
Okay, thank you. My question is about the local solutions, the local tools, made in Africa tools that are being deployed to aid Africa's response to the COVID-19. Are there any local solutions, irrespective of the sectors, that African countries are also making use of from the African perspective? And I think also the SCC director can also help in mentioning the ones that Nigeria is also deploying on its own. So that's my question. Thank you.
Thank you. So Dr. Moeti, we've talked before on these calls about the unique challenges that Africa faces. Are there any unique solutions that we're seeing coming out of the continent?
Yes, I think I can cite, well, first of all, we are working very much to spread information around to people, so people can be informed about the risks, about what they need to do to protect themselves. And one of the unique features of African societies often is how people are connected and people are organized in associations, in various groups. And we are working on communication through some of these groups so that the information is translated from the type of technical language, very often in English, in which it's sometimes initially relayed, into local ways of understanding by their network, so that people can understand can internalize and can be enabled to take action themselves. That's one. Secondly, we have sent out a call for innovations by African scientists, African innovators who understand the local context, and we are getting many indications of interest in supporting, for example, the use of technology. Okay, so technology wasn't invented in Africa, but people who know very well the circumstances under which people are connected, the limitations, are using how to use this, again, to spread information around in Africa to correct misinformation, which we know is circulating around very widely. Really, I think these are some of the innovations in Africa. We are also seeing a lot of interest in using African capacity for tailoring and making clothes. So one of the biggest industries that exists, for example, in Western Central Africa is the production of local clothing. And we have seen in many cases, including here in Brazzaville, my is producing masks made out of cotton, looking at specifications that she has found on the internet. We've also produced a guideline on this, and people are using what we have, what we can, in order to protect themselves at the community level. Recognize that sometimes when we go to public places like markets, it's simply not possible to have physical distancing as we would like.
Thank you very much, Dr. Moeti. Got a couple of questions, one from Shoma Ezenwafor in Nigeria, another from Abdul Brima in South Africa. If we can just ask both of them to put their questions, perhaps Abdul first. If we can bring Abdul up. We need to unmute Abdul in order to be able to hear his question. There we go.
Hi, thank you very much. My name is Abdul Samba Brahima, and I write for the Mail and Guardian here in South Africa. So my question is to Dr. Moeti. Dr. Moeti, given situations in Burundi, in Tanzania, one is tempted to ask about how worried is WHO really about the willingness of some African countries in terms of their response to COVID-19?
Okay, and maybe Dr. Moeti, we can answer that, and then because I think Shoma's questions are for our two doctors in Abuja.
Mm-hmm. Yes, we are observing some countries take an approach to the response which is not quite what we are recommending. So certainly in Tanzania, we have observed that the physical distancing, including the prohibition of mass gatherings, took some time to happen. And we believe these might have been factors, were probably factors in expanding the number of cases. We're seeing a rapid increase in cases there. So we are working through our country representative and with other partners very much to advise, advocate with the government on the measures that we need to take that are being undertaken by other African countries, which is quite difficult. We recognize the challenges in, for example, locking down a city, which is where the virus is particularly spreading, and the need to balance that against the socioeconomic impact. What I can say is that we continue to urge these governments to follow the data, to be evidence-based in the measures that they are taking into place, and also to work with partners who are willing to support the impact mitigation measures that we recognize can be very important. Thank you.
Thank you, Dr. Moeti. And we're going to try and run the call another 5 minutes, so ending at 14:05. Turning to Shoma in Nigeria, can you put your question, please, for our doctors?
Okay, thank you very much. Choma here. Choma is in 14 Nigeria Info FM. And my question is, how soon can Africa begin to prepare for post-COVID-19 era so it doesn't turn into another crisis entirely? Because we already know that this is a storm and every storm leaves debris. So how soon can we begin to prepare for post-COVID-19 era so it doesn't become another crisis entirely? Thank you very much.
Thank you. And perhaps I can turn first to Dr. Aliyu to answer that. And we're just going to have to unmute Dr. Aliyu. There we go.
Thank you. So definitely the post-COVID era will be very different to what we have pre the pandemic, especially in terms of our social interactions with people. We can already see how we have changed the way we've been functioning as a community and as a society. Yeah, actually, one of the key things that were done was, in addition to the task force that was created by the presidency specifically to address the pandemic, we also have a second high-level committee, which is chaired by the vice president. And this is looking across the board at the socio-economic impact of the post-COVID era. They are working with both the private sector as well as our multilaterals. We already have a strategy that is in place that's looking at the humanitarian side, the security side, how do we recover in terms of things like the educational aspects, the impact it's already having on our schools, and also the psychosocial impacts of losing so many people within such a short period of time. I think this is something that would progress over time. It's going to be a lot more work, I'm afraid, after the pandemic rather than during the pandemic. But we hope that in the coming months, things will start to settle so that we can redirect our efforts. One of the pluses is that we already have countries that are sort of sorting out their pandemic, and we are learning from them in terms of how they're recovering. And we hope to use those learning opportunities as well to push through in terms of improving our overall socioeconomic status and making sure that our economies start functioning very, very quickly and rapidly as well. Thank you.
Thank you. Dr. Ihekweazu, anything to add from your side to that?
Yes, I think the key thing for us is, we really don't have the luxury of not paying attention to the work we're doing right now. So we're very, very focused that every intervention, every improvement, everything we do right now has to, one, help us solve the short-term problem, but secondly, help us build for a better tomorrow. So we're really focused on making careful choices about the investments that we're making. A lot of them are actually soft. You may not see them immediately, but we're building people, we're building institutions, we're building to last. And really that's the responsibility that we have as leaders on the continent, because we may never have a second opportunity to do this. So yes, this is a crisis, but yes, we must make the best out of this crisis to make sure that we're never caught napping again. Secondly, is just to pick up a question earlier. There was a question of the impact of the apparent withdrawal of funding by one of our big, one of the other big countries in the world. I mean, the funding for WHO is so important. It's hard to really explain to someone living outside the continent how important this organization is for the work that we do. We rely on them for guidance. Lives are saved because of the work that they do. We don't have the luxury on this continent to build up all the infrastructure on our own, the knowledge, the expertise that they offer. So the organization is critical to our collective survival and therefore the collective survival of the world. And a price will be paid. And I hope we never get to that stage. But if the funding to WHO is affected in the way it may be, that there will be a huge price for humanity to pay, and not just all of us on this side of the world. So I really hope that comes to pass. And I really hope that everyone around the world comes together, supports the organization, not just by speaking, but by funding it to do the critical work it does on our behalf.
Thank you very much. One very quick final question from Rhoda at the BBC in Nairobi. Rhoda, quickly over to you.
Thank you so much for the second opportunity. My question again goes to Dr. Moeti. Seeing that malaria season in Africa is just about to start, what's the impact of COVID-19, especially now that so many efforts are channeled towards COVID-19 and not so much on malaria, seeing that now again the world marks World Malaria Day on Saturday?
Thank you. Dr. Moeti, final word to you.
Yes, as I said, we are very aware of the potential impact on malaria if certain actions are not taken. And what I can emphasize is that we need to make sure that the malaria interventions, the key malaria interventions, are carried on in ways that are adjusted to the situation of the physical distancing enforced by the COVID-19 outbreak. But we would like to have continuation of the distribution of insecticide-treated bed nets. People, including campaigns where this might be possible and where it's necessary, people must continue to be treated for malaria, either in health facilities with physical distancing being maintained or in outreach ways. And healthcare workers need to be provided with personal protective equipment if they feel confident and are able to provide care and treatment to people, both for prevention in terms of distribution of the key items. And then also we must make sure that the supplies that are needed for the to get to countries, and that depends on the decisions of governments to open up in terms of some of the flights that can be mobilized by the international community to make sure that these supplies are there. So if we do not see this happen, if we see a dropping off of prevention interventions like campaigns and net distribution, we risk, as I said at the beginning, to have a return to twice the level of mortality from malaria as we had in 2018.
Thank you very much. A big thank you to all of our doctors for this media briefing. A big thank you to everyone who put questions. Our apologies to those we couldn't get round to in the time available. And we hope you'll be able to join us again. Thanks from Geneva, from Peter and myself.